Today, B&B Dental want to introduce you the new software, the own software for B&B Dental for guided surgery. And we're going to see three different things today. The main concept is about the software of B&B Dental for guided surgery, and the two other things are about pterygo implants and Juxta Grid. So just two words about Juxta Grid and pterygo implant, because tomorrow two doctors explain you, Dr. Roy and Dr. Angelo Banzi will explain you how to use this technique. So let's start for the presentation. The new software for B&B Dental Guided Surgery will allow you to design and finalize a case in an independent, rapid, intuitive, and precise way. So you can download this software from our website, and you can manage all the things that you want. So you can import the DICOM files, you can project your case, and you finalize your surgical guide. And if you have a printer, 3D printer, you can print even your guided surgery. So it's very easy to use, and it's very easy. The learning curve is very user-friendly. This is the workflow. Is the usual workflow that we have in B&B Dental. It's composed by 8 steps, from the diagnosis to the surgery, and it passes for the precise impression, the construction, the release of radiological template, the CVTC scan imaging, DICOM cast model and radiological template delivery, if you want that your project is done in B&B Dental, and planning and surgical guide creation and model, and the surgery is 8 steps. Very easy, and B&B Dental has created this kind of workflow to bring into the end to the surgery in a very easy way and make all the steps in a very few time. Okay, now we are going to see in my presentation there will be 5 different videos and explain you how to use the software. Okay, this is the icon, desk icon. This is the main page of our software. You have the possibility to import DICOM files. You have to choose the right folder, proper folder. And then the software imports into the software the DICOM files. In these windows, you have the possibility to cut the useless part. And on that view, you can check the part that you want to import into the software. After, you have the possibility to cut better the DICOM files. You can choose if you want to cut the part, choose or the outside part. 2 different views, RX or bone view. You can regulate the exposure and the light. And then you can create the panoramic curve. So during the drawing of the panoramic curve for the lower jaw, I prefer to follow the path of alveolar canal, because after drawing the panoramic curve, you can see on the panoramic view both 2 nerves. And it's very important when you go to project your case. Okay, in this case, you will see both the 2 nerves. And if you want, you can adjust the panoramic curve by point. Okay, the software gives you always a panoramic curve of default, but I don't like it because it is a panoramic curve of default for the upper jaw, for the lower jaw. It's always the same, and I don't like it. So I prefer to draw my panoramic curve. Computer tomography combine. How has to be? Our software read just DICOM DIR format. You have the possibility to export from your combine, if you have a combine in your dental studio, different format of files. Our software read just DICOM DIR format, is the rough file. Medium or high resolution. Okay, you can decide, you can choose the resolution into your combine. Usually the medium resolution is between 0.3, 0.6 millimeter at slice, because the combine, when perform the CBCT, create a different slice, and the thickness of the slice is the better from 0.3, 0.6 millimeters. Radiological template well positioned in the patient mouth and well stable. This thing is very important, because if the patient or if you don't put in the well position in the radiological template, it could be a very big problem, because this is the result. This is the gap about radiological template and gingiva. This is the black line, and black line means that you have to perform the CBCT again. Because in this case, the radiological template is not in the proper position, and it's a big problem. Avoid using the fork of the combine, because the fork of the combine could move the radiological template, mostly for the total dentalism. In case of total dentalism, you have to avoid, you must avoid using the fork, and for partial dentalism, you can use the fork if you want to stabilize the head of the patient, but it's better don't use the fork. Use only B&B Dental RadioPack markers, because the software read the shape, the proper shape of our markers, and the matching will be sure better. Okay? Don't use other RadioPack markers like Guttapercha or other things. You have to use just our RadioPack markers. It's very important, because the shape of the RadioPack markers, it's read by our software, and read just this kind of shape. If the patient has a prosthesis in his mouth, you can use the patient prosthesis as a radiological template. But the prosthesis, it must be adherent to the gingiva, okay? And only in case of total dentalism, you can perform the double CBCT system. The double CBCT system is two different CBCT image. The first one is a radiological template into the patient mouth, and the second is just radiological template. You put the radiological template to the rest chin and with the teeth, and you can perform the second CBCT just with the radiological template. After, by our software, with the help of our software, you can transform the DICOM files in STL file, and you can use that STL file to obtain the gingiva. And in this case, you can matching the radiological template, gingiva, with DICOM files. And in this case, you can't need to take an impression. So, the second video. The matching between between DICOM files and the STL file. In this case, we don't have the radiological template, but we have just the model. Because the patient has a lot of teeth in his mouth. In this place has two crowns that generate scattering effect, but is not a problem. And we can match the teeth of the DICOM files with teeth of model. Obviously, same point, same color of the point, and same place. Okay, put the same point on the DICOM files and on the STL files. Okay, and then click on Align Surface. To finalize the matching. Okay, usually the matching is very precise, okay? But if you want, you can check the proper position of the STL file in matching with DICOM files, and if it's not very perfect, you can adjust the model on DICOM files. You can use that view, so look here, there is a scattering effect. So if the patient has a lot of metal in his mouth or a lot of metal crown, it's a big problem for the matching because the metal generate a scattering effect and make a wrong shape of the teeth. So if the patient has a lot of metal in his mouth, you need of a radiological template. Otherwise, you can perform the matching by teeth. Two different types of matching. So the first one is by radiological template. In a dentulous patient, okay, if the patient doesn't have any teeth in his mouth, you have to use the radiological template. Is much important. Otherwise, you can't find the matching point to align the DICOM files and the model. And in case of a lot of metal, in the partial and in a partial dentulous. So you have to use our marker. That is the disposition, is advised this disposition, we suggest this position, one behind the central incisors, two on vestibular surface of canines, and two on vestibular surface of molars. This disposition is much precise to align because the software align the DICOM files and the STL files by triangles. So the software uses triangles to perform the perfect alignment. So more they are and more triangles and bigger they are, more precise will be the alignment. Second types of matching. You can perform the matching by teeth. Okay? In a patient with residual teeth, the image matching can be done both with the markers or with imaging of the residual teeth themselves. So if you have a patient mouth free from metal, okay, if you have one or two crowns is not a problem. But if you have a lot of crown, full arch of crown, metal crown, or zirconium, that that material generates scattering effect, or big reconstruction in the patient mouth, you have to use the radiological template with markers. Otherwise, you can perform the alignment just by teeth. Third video, it's about nerves, about the drawing of the nerve, the design of the path of the alveolar canal. Okay, I prefer to work on the actual files because I can take the axis of the software and put it in a proper position. So, in a cross action, I can see well the diameter of the nerves. So, create a new nerve. Then you can increase or decrease the diameter of the nerve because they are different from mouth to mouth. Okay, and point by point, you can design the path of alveolar canal. Double click, and the software automatically gives you the nerve. Then you can adjust in all the view, you can adjust the position of the nerve and find the proper position. Then you can check on the 3D the position of the nerve. The same thing for the other nerve. And then you can adjust it to find the proper position. Okay. Word collision, much important in the software. Mostly for nerve implant, collision nerve implant. There are three types of collisions. The first one, more important than the other, maybe, sure, is collision nerve implant. The other two are collision between implant and between model, gingiva, and sleeve. So, the safety zone is 2 millimeters. I prefer to use 2 millimeters of safety zone because in this case I'm sure don't close too much to the nerve. Red triangles means too close, not collision, just too close. Okay? If you go 1.9 millimeter from the nerve, the software allows you, warn you on the position of the implant. If you want, into the software, there is a classic gear wheel for the menu, and you can open this window, and the first page of that window is interface, and you can change the default setting. I think, if I remember well, that the default setting is 1.0 millimeter. Okay? So, if you want, you can go into that windows and you can change the default setting. Third video, tooth and implants. In that case, if the patient doesn't have one teeth or two teeth, or if you want, you can create a full arch. You can put some teeth, or all the teeth that you want, on the model. You find the right position, you adjust to find the proper position of the teeth. Okay, you can work on all the views, okay? Cross-section, panoramic view, actual files, and on 3D, if you want. And then you can insert the implant. This is our libraries, and in our libraries there are all the implants, all the abutments, multi-unit, everything you want. Okay, look, red triangles and purple triangles. Violet triangle is a collision between anatomical part and sleeve. And then you can put some abutment, inclined abutments, 25 degrees, 15 degrees, straight abutment, all the color high is all the present into our library. Okay. Now appear the windows for the sleeve. Okay. With that windows, you can move up the sleeve, you can rotate the sleeve to find the proper position of the sleeve and remove the sleeve from the collision. Implant lines. As you well know, in our company, in B&B Dental, there is a different lines of implants. The guide surgery can be performed with all the lines, slim, trépied, and évo, except wide, because wide is too big. In our company, we have two types of sleeves, 4.2 and 5.5 of inner diameter. Implant wide start from 5.5 of diameter and is too big to pass through the sleeves. But if you want, you can you can start the surgery with the guide, and then you can remove the guide and bring into the end the surgery with traditional surgery. So you know already the position of the osteotomy, the inclination, and you have just to bring into the end the surgery. Worm collision implants. B&B Dental GS is the name of the software. Allows you to pay attention on the most important part of the mouth. In this case, is not important part of the mouth like in the case before, collision implant nerve, but because it warns us to the collision, such as between implant and implant, like in this case. Safety zone 1.5 millimeter at implant. So to implant 3 millimeters. Okay, 1.5 at millimeter. At implant, sorry. Light blue triangle means to close. Okay, not collision, but just to close. And if you want, on the same windows that we have seen before, there is interface implant collision, and you can adjust, you can change the default setting. If I remember well, the setting of default is 2 millimeters, but 1.5 millimeters is enough. Okay, is a very good distance to obtain for between implant and implant. Fifth video about the design of guided surgery. Okay, so after the implant planning, you can design your surgical guide, point by point. Okay, double click, and the software automatically finds the proper position of insertion for the guided surgery. Generate a guide. And then you can make some hole that you can use as a checkpoint. And one behind the sleeve that you can use for the injection, for the anesthesia. And some windows on the teeth, and you can use it as a checkpoint. Okay, this is the surgical guide. After that, you have the possibility, clicking on OK, to export the STL of guided surgery, and then you can print by 3D printer your surgical guide. It's possible to export even a report. Into the report, there is written what implant you used for the planning, and the drill that you have to use during the surgery, from the first drill to the last drill. Okay. So third collision warning, sleeve anatomy. So this is not much important, but it's important for you because if the sleeve goes too much in collision with the anatomy, okay, could destabilize your guide. So, and in this case, is not a great thing because the proper position is the well position of the surgical guide is much important for the surgery. So, in case So I prefer to use the standard position of the sleeve, okay, because the doctor don't have to remember that to use a different reel from the proper osteotomy. But in case the sleeve goes in collision, for half a millimeter is not a problem. For 1 millimeter is not a problem. 1.5 millimeter is not a great problem. 2 millimeter is a big problem. So in this case, you have to move up the sleeve, okay, in position +2. Violet triangle doesn't mean too close, but means collision. So if the sleeve goes in collision with the anatomy, the software warns you on the collision. Half millimeter is not a problem, 1 millimeter is not a problem. If the sleeve, if the collision exceeds 1.5 millimeter, you have to move up the sleeve. This is the window that we have seen before, where you can move up the sleeve in position +2 or +4 if you want. And remove the sleeve from the collision. In this case, the collision is not big and is not a big problem. But if the collision is very high, the collision, you have to move up the sleeve. So this is a different position of the sleeve. Standard position. The sleeve, the peak sleeve is always 5 millimeters of length. And 4 millimeter is free for the gingiva, is expected for the gingiva. In case you have 6 millimeter of gingiva, you have 5 millimeter of gingiva is not a problem. Goes in collision of 1 millimeter and is not a problem. But in case you have 6 millimeter of gingiva, you have to move up in position +2 the sleeve. In that case, okay, in our kit, there are a different length of drills. But the maximum length is 40 millimeters. And if you have the sleeve in position +2, the maximum length of implant that you can insert into the bone is 12 millimeters. Why this thing? Because 14 millimeter is the drill, and the sleeve is in position +2. You have move up of 2 millimeter the sleeve, and the osteotomy that you can obtain in this case is just 12 millimeter. But if you want, you can remove the guide and you can perform the surgery in traditional surgery. In this case, in the position +4, you can use this, the sleeve +4 if you have a post-extractive implant, and you have to keep down to obtain, to find the compact bone and not the alveolar bone. And in this case, you can insert maximum 10 millimeter of length of implant for the same reason. 14 millimeters is the drill, position +4 for the sleeve, and maximum osteotomy is 10 millimeter. But if you want, you can remove the guide. 3 different types of surgical template. The first is supported by teeth. This is more stable than the other. I think if the teeth are in health, this is the best guide surgery that you can perform, because the teeth allows you to find the proper position of the surgical template and the proper stability of the surgical template. If you want to increase the stability, you can use the crystal pin. The crystal pin goes directly in the sleeve for the implant. Second surgical template types is mucosal supported. It's not stable because usually the gingiva is soft okay, and is not very stable for the total dentalism. But you can help the patient and he can bite, he can beat the silicone bite and can achieve the proper stability and the proper position of the surgical template, and then you can insert the lateral pins. If you want, in addition to achieve the perfect stability, you can use also the crystal pins. Last type is bone supported, and in this case you can put the surgical template directly on the bone. The stability is good because the contact with the bone is very hard. So you don't have a problem in this case. And in this case, you have to use lateral pin and, in addition, if you want, crystal pins. Obviously, the lateral pin has a proper sleeve and a proper pin. Okay, this is our website where you can download our software. www.bebdental.cloud is the software, is the website. This is a toolbar, a download bar, sorry. And you can download our software, and then you can install the software in your laptop. And then you have to make the subscription. You have to fill the form where you have to put your name, your last name, your country, your mail is important. And then you can use our software. Our software is completely free. Okay, you can download it, you can use it. You have to pay just when you export after your implant planning, after design your surgical guide. After that, you can export the STL file, and then you have to pay a little bit to export that file. Okay, my presentation about software is over. Now there is other two things, Grid and pterygo implants. So, in the dental field, it is important to always research and develop new methods that can rehabilitate even patients who have lost this possibility for different reasons, with no removable prosthesis and able to satisfy aesthetic needs. Today is possible with some surgical technique as guided surgery, pterygo implants, and grids to restore patients with severe bone atrophies. So B&B Dental has decided to integrate a new services to the doctors in addition to the guided surgery. We start with guided surgery, and then we developed other services as pterygo implants and grid. So with the pterygo implants, you can perform this kind of surgery in guided surgery, because we can create a guide to insert a pterygo implant, and or if you want, in a traditional surgery. One workflow for all the services. The doctor don't need to remember a different workflow, okay, but just one workflow. This is the workflow that we have seen before for the guided surgery. The only one thing that changed in this workflow is this, model and surgical template, and for the other thing, there will be the grid. For the pterygo implant, is the same thing for the guided surgery, change just for the grid, this step. but all the workflow is always the same. Just 2 words about the pterygo implants. I can't show you the surgery. I'm not a doctor. But I can show you the pterygo implants, the abutments, or the kit. The pterygo implants allows the implant prosthetic rehabilitation of the maxilla affected by severe bone atrophies, where it is not possible to, for various reasons, to intervene using the technique of the great sinus lift. This is the kit. A kit is completely of drill for guided surgery and drill for traditional surgery. Compactors for guided surgery and traditional surgery, ratchet and straight manual keys. And it's completely with all the tools with all the drills that the doctor needs during the surgery. Pterygo implants and components. 2 different pterygo implants, 2 different lengths of pterygo implants, same diameter, 4.75 millimeters. 2 different lengths, 18 and 16 millimeters. Abutment, 4 degrees, multi-unit 4 degrees, and long hexagonal key. Just 2 words about it. Oh. Okay. Just 2 words about pterygo implants. Tomorrow, Dr. Roy will explain you how to use the pterygo implant. Now, Juxtagrid. Juxtagrid allows prosthetic rehabilitation on patients who cannot undergo to guided or traditional implantology due to serious cases of bone atrophies. It's very interesting, the Juxtagrid. Prosthesis as a radiological template. If in guided surgery we have seen that we can use a prosthesis of the patient as a radiological template or not, is your decision. In this case, we need absolutely of the prosthesis of the patient. Why this thing? Because otherwise we can't know the position of the teeth, and if we have to put some abutments or a MUA, or there is a helicopter, no. Somewhere we can know we have to know the position of the teeth, the highest of the teeth, the inclination, angulation of the teeth, and is much important. Then you can duplicate the prosthesis of the patient or the future prosthesis of the patient, because you have to realize absolutely a prosthesis, especially in a partial dentalism where the patient doesn't have a prosthesis. You have to put some teeth and realize a prosthesis, because we have to know where the position in 3 dimensions of the teeth. Printing and design. To be able to proceed with printing, you must first take care of cleaning. Because when you send me a DICOM files, the DICOM file is not clear, is like a fog, is not very clean. So we have to use a segmentation software that is present as a tool into our software, for guided surgery, and you can use it to segment the bone, mandibola or maxilla. And then we can print the part to rehabilitate. After that, we need to do the design of the Juxtagrid. Okay? If you want, you can perform the design of Juxtagrid in your country by yourself, or otherwise we have some doctor that can help you to design the Juxtagrid. This is the components, abutments, 4 millimeter and 5 millimeter for the anterior parts and posterior parts. For conimetry abutments, 2 degrees total, and the screws, the transcortical screws. 12 millimeter, 10, 8, 6 millimeter, total length of the screws. The working part is 2 millimeter less, 10, 8, 6, 4 millimeter. And the hexagonal key is already, you have already, if you use our implant, you have already the hexagonal key. Once the Juxta is designed, they are printed and sent to the doctor to the final inspection. We can send you this software, and you can check the position, in this case, the position of the nerve, or the position of the sinus, or the position of the root of other teeth, and you can check the position and the proper length of the screw to insert into the bone. This is the software. This is a model, the Juxta grid. There are the nerves that you can check the anatomical part that you want preserve. Okay, this is the mandibular, prototyped mandibular with the Juxta grid, and we can send you this thing. After the approval by the doctor of the project, we go on with titanium printing by laser melting and subsequent electropolishing of the Juxta grid. So we can finalize for you this thing, and we can send you everything for the day of the surgery. Okay, my presentation is over. I thank you for the attention. Thank you very much. Thank you.
So, I would like to thank Alan. Alan is our manager for all the digital parts, guided surgery, Juxta device, implant. So, in case you have more questions, if you want to know something more specific, he will be here for the 2 days. So you can talk to him and ask something more. Okay. Alan, thank you.
Thank you
for your lecture.
Thank you.